the one
Keeps
my
you good
kids
health.
like. Yeah, really good. That's one of those protein ones. Is it just good?
Thank you, Dr. Saba. Good morning. 5-year mortality rate for a diabetic foot ulcer. To put it in terms that aren't as fancy, the percentage of people that are dead within 5 years of having a diabetic foot ulcer. To give you a basis of comparison, and Dr. Domer mentioned this morning, breast cancer is 18%. Percentage of people that are dead within 5 years of this diagnosis. So what do you think a foot ulcer is? You think it's more or less? 20%? 30%? The answer is 45%. This is a startling number. 45% of people that have a diabetic foot ulcer are dead within 5 years of having the ulcer. Now certainly, a lot of these people are sick, and I'm going to allude to this later on, and Dr. Domer mentioned it this morning. Oftentimes the ulcer is a sign of a greater underlying problem, or a general medical condition which is contributing to the ulcer, and certainly a lot of times that's what kills these people. But make no mistake, there is significant morbidity and mortality associated with just the ulcer itself, and the fallout from having the ulcer, the treatments or attempted or failed treatments of the ulcer, infection that may be associated with the ulcer. Those things do lead to significant morbidity and mortality. So here's where our 45% falls on the scale. You can see the neuropathic ulcer there. And again, I like to use breast cancer as a comparison because this tells us a couple things. Number one, it tells us the severity and the seriousness of what we are dealing with. This is a terrible problem. It also gives us some idea as to the awareness that is lacking as far as foot ulcers. Somebody gets diagnosed with breast cancer, they're in the oncologist office that week, they call 10 family members, they get flowers sent to them. Somebody gets diagnosed with a foot ulcer and they put on Neosporin and a Band-Aid or Silvadene and a Band-Aid, and they maybe see a specialist in a couple weeks. So we're missing something here. The treatment is not as quick as it should be. It's not as urgent as it should be. Furthermore, the awareness of the general public isn't maybe as good as it should be. I don't think people are educated as well as they should be as far as the severity of having a diabetic foot ulcer. Breast cancer gets a tremendous amount of attention, which it deserves, of course, not knocking that. But it has a month and a walk and t-shirts and bumper stickers and stories in the news, and of course those things are warranted. But where's the attention to foot ulcers? Nobody realizes what a horrible problem this is. It made me laugh that NFL players who, some would say are the toughest people in the world, spend a month wearing pink gloves and cleats and pink towels to recognize breast cancer. What are we doing for foot ulcers? So I thought it was funny to imagine, what could the NFL do to recognize foot ulcers? Put a big disgusting picture on that 50-yard line for a month. So that addresses the seriousness of the problem and the effect that this has on people's lives and the morbidity and mortality that is related to these diabetic foot ulcers. I'm going to skip over some of these numbers. Some of this was covered this morning. If we skip down to the bottom, like I said, we covered the impact on people's lives that this has. What about the impact on the economy? If we could decrease the amount of lower extremity amputations by only 25%, that leads to a $3 billion in savings a year for our healthcare. That's a significant number. We hear from government officials that we have an economic problem and that the way to fix that is to fix healthcare. So how do we fix healthcare? We fix healthcare by decreasing spending. We don't want them to decrease spending by paying us less. We don't want that. We want them to decrease spending by having to spend less money on treating people. This makes a big dent. So that's significant as well. So that addresses the seriousness of the problem. This slide, and it looks a little busy, I'm going to explain what it is going to illustrate the need to jump on these things quickly and to not delay treatment. If you look at that 9% on the right-hand side, underneath that it says the ulcer is 53% smaller in 4 weeks of treatment. So what this tells us, this was a study that was done that evaluated the healing rate of ulcers. If the ulcer is not 50% smaller after 4 weeks of conventional treatment, we have a 9% chance of getting it to heal within the next 12 weeks. When ulcers don't heal, it leads to infection, it leads to amputation, and it leads to death, as we saw in the beginning. So I'm going to say this multiple times because to me it's a startling number. If the ulcer is not half the size it was where you started at within 4 weeks, with a 9% chance of success. That's an ambitious goal. Think of something you can all, everybody in the room can think of somebody they've been looking at for a long time with an ulcer that is not 50% smaller. Or even somebody you've been looking at for 6 weeks. If it's not 50% smaller, you have a 9% chance at success. So here we are. We're going to go home today and enjoy the rest of our weekend. And on Monday morning, this lady is going to walk in. This is a patient we took care of in our center. The women all know her well. She's missing her other leg. How are we going to treat that? How are we going to get that half the size in 4 weeks? That's an ambitious goal. It's difficult, but we can do it. And we can do better than what we've been doing. And just to give you a preview, the most important thing here is offloading. That's the bottom of her heel. And I gave you a hint that she's missing her other leg. We have to get the pressure off of that. We'll get to that. The fact remains, we have to do a better job, and we have to be aware from the first time we see this patient, the clock is ticking. We have 4 weeks to get it halfway smaller. So how are we going to do that? Important thing is to do a good history on these patients. We have to let the people talk. They will give you a lot of information. It's a study that showed that doctors have an average time of 18 seconds before they interrupt the patient from the time you say, "What brings you in today?" 18 seconds is the average time that we let somebody talk before we interrupt them. Let them talk. They'll give you a lot of good information.